Hello, I'm Dawn Stillwell from Contact.
And I'm Victoria Federico from Access Legal Solicitors.
Today we're doing a special educational needs webinar and we're going to talk a bit around special educational needs for your child, education healthcare plans and what should hopefully happen for your child.
Okay, so we're going to look at Sen Support, education health and care plans, legal duties, the local offer, and then some information on resources and how Contact as an organisation can help you if you need anything further.
Okay, so a definition of special educational needs here is one that you should all be seeing on your screens, which is a child or a young person has special educational needs if he or she has a learning difficulty or disability which calls for a special educational needs provision to be made for him or her.
So a child or young person has a learning difficulty or disability if they have significantly greater difficulty in learning than the majority of others of the same age, or they have a disability which prevents or hinders them from making use of the facilities of a kind generally provided for others of the same age. So your child or young person doesn't have to have both of those. Crucial word is or, so they can have either A or B. Some children, of course, may have both as well. So these are the standard definitions across the country that you may need to be familiar with when contacting your child's school or your local authority.
Okay, so the four areas of special educational needs, or SEN as we know it, are communication and interaction, cognition and learning, social, emotional and mental health, sensory and or physical. There would be the areas that you would be looking at for your child to be requiring some additional support or potentially an education healthcare plan.
So some information about the law now. So the Children and Families Act 2014 came into force on the 1st of September 2014. We're not going to talk about every single provision from that or every single section, but just kind of draw your attention to those that we think are most relevant. So section 19 is really important around yourself, your children being included in decision making and in putting forward views, wishes and feelings. So if we have a look at the 4 points on the slide, it's in some ways difficult that this had to be put into the law. Local authorities should be working with families in a collaborative manner, but you and your child or young person should be encouraged to provide your views on whatever it is in relation to special educational needs for your child, and the local authority has to take those into account. So that means they have to listen to what you've said and see whether or not that's something that they can agree with. The probably most interesting and useful one for families may be the 4th bullet point. So the child and parent must be supported to achieve the best possible educational and other outcomes for children and young people. So it's just something that's kind of good to know if you are having difficulty in having your point listened to or requested, that you can rely on this section of the law.
Okay, the Code of Practice, which is the law that supports the SEN support a child should need, is a legal document, and if you can order and buy the document, it's very, very bulky, so we normally suggest that you download it, and there are easy read guides as well. But this is what we'll refer to during today's webinar, to give you an idea of where to go and the sort of sections and paragraphs that you could possibly quote to your schools or other support services. And so if you go onto Department for Education, that's where you would be able to find the links for the SEN Code of Practice. And moving on, as we go through this session, you do have opportunities to ask questions. So by all means, do send us a message and ask the questions whilst we're live. We can hopefully then answer them for you while we're online.
Yeah, or alternatively, at the end of the slides, you'll have some contact details as well. You're very welcome to get in touch or ask questions if you're watching this recorded as opposed to live as well. So do you want to?
Okay, so within mainstream schools, they should all have a special education needs coordinator, SENCOs, you'll know them as. Some schools just have a SENCO in place. Other times they are also doing this alongside other roles and maybe part-time. So do bear that in mind, but make yourself familiar with your SENCO. And also, if you need to have any meetings, then hopefully your SENCO should be involved in that along with your class teacher.
So mainstream and special schools, they must, so this comes from the SCN Code of Practice, so it's not an optional, it's a requirement, that they must publish SEN information on the school's website. They must also have an inclusion policy, accessibility plan and behaviour policy. You should be able to access those online as well. So if you're new to the system of special educational needs and you're looking for a bit of information on what your child's school offers or says they offer, then have a look on their website for those documents and hopefully be able to find some useful information, particularly around those areas. Of course, there'll be other policies that you may find useful and interesting as well. And if you've got questions on them, if you're going to meet with the SENCO, maybe take along a copy of the policy or reference to it to see if they can give you any more detail if anything's not clear or you think that your child should perhaps be receiving something that's detailed in one of those policies.
Okay, so SEN Support is the first initial link into support for your children. So some schools will call it different things, so they might still call it Early Years Action Plus or School Action Plus. Sometimes they're still called individual education plans, IEPs, but the basis of it should be that it is on the Sen Support basis, which we'll cover off in a moment. Okay, so schools must identify pupils who have SCN and need extra help through SCN support, and they must tell their parents if the child's receiving SCN support, and they must keep a record of the support that they provide. So you'll see in that must is highlighted all of the way through there. It's not that it's quite a nice thing to do, it's something that must happen. So that's quite a strong word there, but that should happen for your child. Okay, the basis of SEN support is assess, plan, do, review. So schools should be assessing your child and gathering information about their needs. And moving around the diagram, you'll see plan. So deciding what support is needed for your child. Do it is, so they're going to put a plan into place, and they should also be letting you know what they're going to be doing as well. Parents, as we said previously, they should be included in this, and then it would be reviewed, and it's on a full term cycle. So if your child was reviewed in September through to December, SEN support would start in January and then go through to the Easter term, with reviews within that as well. And then, as I say, that the school should be letting you know, so either with a letter home or telephone calls, emails, some correspondence to let you know how your child's doing on SEN support and reviewing it, whether they're okay to come off of SEN support or would need to stay on that in a continued cycle.
And so schools should, and you notice the difference between the word must, as we've seen previously, and now saying should. So schools should involve specialists if your child continues to make little progress or work at substantially lower levels than expected. So specialists could be educational psychologists, it could be if your child has a visual or a hearing impairment, could be a qualified teacher for the visually impaired, for example, to see if they can give some information, strategies, help and advice if your child is still not making the progress that they should be and could be making.
Okay, so meetings with school and how to prepare for meetings. Basically, when you're attending a meeting or if you're invited into a meeting, some key things to do are check what the meeting is for. Sometimes parents aren't necessarily completely informed, and they don't always know who will be attending. And if you're going into a meeting, obviously it's ideal to know who's going to be there and what the subject matter is for your child. So is it a review of SEN support? Is it a discussion to put them on SEN support, or maybe further support needed? So it's ideal if you can get that information before you go into school. And quite often it's good to ask the school via email sometimes, so you have got a log, a paper sort of trail as to say who's done what and when things happened as well. So it's quite a good idea, a good way of you keeping a track on it as well. You can collect any reports that you've got, take them along. We always say use photocopies because you never know when you'll need them next, and sometimes you don't always get things back, so always take photocopies in. So any reports you have, school reports, medical reports, test results that you might think are relevant for your child, if things have been done within the NHS or you've had any psychology reports done, always take along everything with you. And most importantly, take your own notes, so anything that you want to raise about your child and what they may be like at home. Because sometimes when children are at home, their behaviours can display quite differently. They have anxieties in school, but don't let them out until they're at home. Make all kinds of notes about things like that. Keep a bit of a diary and take that along with you. So anything that you want to say about your child, quite often when you get into the meeting, you do sometimes forget what you wanted to mainly say. So take that along with you as a bit of a checklist and reminder of what you want to discuss at that time.
Okay, so SEN support is the additional support in school for children as sort of often the first level. Some children will be well supported on SEN support and will remain on that or even come out of that. For other children, either those with more complex or profound needs, or those who have tried SEN support and that's not provided sufficient help and support in school, then you might be looking at an education, health and care plan. So that is a legal document. It will describe the child, young person's special educational needs, special educational provision, and then the educational placement. So it can cover children and young people in education or training up to 25. So the system for special educational needs now in England is sort of birth to 25. It is jointly commissioned, or should be jointly commissioned, by Education, Health and Social Care. Some children will have education issues and won't have any health or social care requirements. For others, there'll be the need to have input from all of those three providers. You'll notice here again the word must. An education, health and care plan, or an EHCP as you'll probably hear it referred to, it must be person-centred and focused on outcomes. So it has to be all about your child or young person. What is it that they need? What's the description of them? So it shouldn't be that for children with certain diagnoses or disabilities that document will then look the same. It has to be individual. And focused on outcomes really means that it needs to all be preparing your child or young person for being as independent and adult as they possibly can. And the way in which you do that is to set outcomes that should be in conjunction with you and anybody else working with and supporting your child. And then the plan works towards helping your child or young person to achieve those outcomes. So it's really simple in theory, and we're going to come on to look at the aspects of education, health and care plans in a bit more detail as well. So the first step, an education, health and care plan, is a sort of a two-stage process. Anybody who knows anything about the previous law statements of special educational needs was very similar, that first of all there was assessment and then there's a decision. So for education, health and care plans, first stage is to request an education, health and care needs assessment. So you as a child's parent, your young person, or a school or post-16 institution, so wherever your child attends school or if they're in a college, can ask for an education, health and care needs assessment. The way in which you ask for one is to put it in writing. It could be an email, could be a letter, to the Special Educational Needs Department of your local authority, making a request for that needs assessment. There are templates available online, so you don't need to reinvent that. You can just look at a template. There's a template on the contact website, and fill in the details around your child young person. The more information you can give, the easier it is for your local authority to understand the nature of your child's needs. So, for example, if your child has autism, you wouldn't just put my child, details of your child has autism, full stop, because as with any diagnosis, the way that it impacts on them at school is going to be different for each child. So the more information you can put around how their needs affect them accessing education and engaging in learning, the better it's going to be and the easier it will be for your local authority to understand why it is that you're asking for an education, health and care needs assessment. So your school can do it, but if they don't agree that your child needs additional support, or perhaps they're not going to do it in the time frame that you want, then you can make that request yourself and don't be put off if school or college isn't able to help you with that.
Just going back to the template letter, on the contact website, if you go into our publications, there is there's various fact sheets on Sen Support, amongst other things. But on the there is an actual fact sheet around Sen and asking for assessments, and that's where you'll find a copy of the template letter. Okay. Okay. So an education healthcare plan assessment timeline. It's hoped that it would be completed in 20 weeks. Often when we run this session, and you can see faces, we're often quite honest about the fact that it doesn't normally happen that quickly, and sometimes it can go on much longer, particularly where you have breaks in the term. So it depends on when in the year you start assessing. If you ask for an assessment in May, the summer break often delays things a bit as well, because the child's not in school to be assessed and things like that. So this, as I say, is what should happen, but the slide gives you a good guideline on deciding about a plan for your child. So as you can see, in the first 6 weeks, the child's parents or young person must be consulted. In weeks 7 to 16, you can see that the local authority will be making a decision on your child and whether they would be getting an assessment for an education healthcare plan. So what I would say, so around week 6 or 7, if you're told no, which we often raise in sessions, that's quite common, isn't it, Victoria?
Yes. Yeah, and we find that a lot of parents, partly in the sessions that we run on this and partly inquiries that we receive independently, a lot of parents are told, no, your child's not going to have an education, health and care needs assessment, so sort of stopped at the first stage. It's really important for you to know, and we are going to come on to the fact that you can challenge that, so not to be put off by the answer no. Quite a lot of the decisions perhaps are not made purely on the needs of your child, or perhaps you haven't explained your child in enough detail and the local authority doesn't quite understand why it is that you think that they require an assessment and possibly a plan. It is simple. Education, health and care needs assessment should be agreed by a local authority if your child has or might have special educational needs and they might require support through an education, health and care plan. So the legal test is relatively low compared certainly to, I think, what a lot of the families that we come into contact with either think or are told by schools and local authorities as being the requirement. So this is a good overview slide. If you're at the start of the process, please don't let it put you off all the different boxes and the times that you can be told no. It's more around you having the information of what you can do, what your local authorities decision-making process and timeline should be, and keeping an eye on that. If it happens outside of the 20 weeks but you're making progress and you're perhaps negotiating with the local authority on things, then that can be fine. If you're well outside the 20 weeks and you haven't even had an answer to your request for an assessment, obviously that's not acceptable, and your child ultimately is the one that's potentially missing out on support that they may need. So the timeline is good for you to keep and make reference to.
Yeah, I think the rest of the things is quite self-explanatory, and as Victoria says, if it does go over that, but you can see how evidence is gathered and roughly whereabouts that will happen, and that local authorities will make decisions. The key points to end this slide on are the 15 calendar days. So once you have a draft plan sent to you, you've got 15 calendar days to ask for any alterations or add any further comments into that plan. So and you would be, that's your opportunity. If you do think you may need to add something, that may be a piece of evidence that you haven't received from someone, you can ask for that to be extended, but you must keep in contact with the local authority. And in Cambridgeshire, that's the START team, and that you would be dealing with. So just make sure that you are liaising with them. Okay, thank you.
Okay, so an education, health and care plan is split into different sections. We've highlighted in these slides in red the sort of key ones from an education point of view. Section A is the parental young person section. So in that section, it's for you, if you're a parent, to put down anything that you want. So your views of your child, their views of themselves, their aspirations, their interests, any information, detail about them. It's quite nice sometimes as well. We often see this where people put a photograph or a couple of photos, maybe of your child with their family or doing an activity they particularly enjoy. It's quite nice to set the document with a bit of a scene of your child as a young person, rather than just a young person with additional needs. Section B is the description of your child's special educational needs. So this is the section where really it needs to go into much more detail about the things that your young person finds difficult, the things they can't do or they struggle with. So that section can sometimes feel a bit negative, but unless it does describe the difficulties your child has, then they're not going to get the support and the provision in school that they need. C is around healthcare needs, and D, social care needs. I'm not going to talk about those too much, but they're anything in relation to those sections which relate to their special educational needs or their disability. Section E is the outcomes that we mentioned earlier, so anything that your child or young person is working towards. As part of the education, health and care needs assessment process, when information and advice is being gathered from people, including yourself and any professionals working with or involved with your child or young person, they will be asked by the local authority for any outcomes that they think are relevant. So that might be from their professional experience or in consultation with you, your young person. Section F is the special educational provision for your child or young person that is directly related to the information in Section B. So you can't have provision in Section F providing some additional support, so for example speech and language therapy for your child, if there isn't any description of their communication and interaction needs in Section B. So those two sections need to almost go hand in hand to make sure that anything that's described as a need in B has some provision in Section F. The G and H, health and social care sections, are related to the description of their needs in C and D. Section I is your child's school, placement, other type of education or training. So that would usually be if your child's going to attend your local mainstream primary school, for example, it would say local mainstream primary and then the name of that school. And then Section J is if you've asked for and agreed a personal budget with your local authority to deliver some or all of the provision in Section F, then that personal budget would be detailed in Section J. We're not going to talk about personal budgets today. It could be a whole topic and webinar on its own, but there is information available online. You can certainly ask us outside of this webinar if you've got any questions on personal budgets as well. So you can see there's quite a lot of different sections. They don't have to necessarily be in that order. Quite often, for example, in Cambridgeshire, you see Section I at the very front, so it will have your child's name and contact details, and at the bottom will say Section I and the school. So if you're going to the back of the plan and thinking, oh, there's no school named, it may well be at the front, just something to bear in mind.
Okay, so we've had a question coming from Sarah, and she's asking that is it true that your child has to be academically 2 years behind? This isn't actually a true quote that it's a good myth that it does go around, but your child doesn't have to be 2 years behind. So that is something worth bearing in mind. You can, so if you are told that, you can also quote or ask whereabouts in the SEN Code of Practice that would be shown, because it isn't there. So for you, Sarah, you don't need to be considering that or waiting for your child to fall behind. If Sen Support isn't working for your child and keeping them where they need to be, and that's where then the change to an education healthcare plan should be looked at. Your child should certainly not be at, say, in year 5 working at a level of year 2 before you would be able to start the process. So do bear that in mind.
Yeah. Okay, great.
Okay. Okay. So where we look at outcomes, which are section E, you'll see that they're everywhere in there. It's often called the golden thread. And if you were to Google SEN or education healthcare plans and golden thread, you'll see that the sections should all link together. So we've got the blue lines you can just see on the bottom of the slide there, and there's one, aspirations is your section A. So you would be considering your child and what they would need and within the plan, and what they want out of life. So there will be short-term aspirations and long-term aspirations. So you might have a child, for example, that goes to the toilet but can't wash their hands very well, and obviously that is a need, that a child needs to be encouraged to wash their hands properly, and if they were to get in a mess or anything, that they can clean their hands sufficiently after going to the loo, as an example. So and that would be within a need. So an aspiration may be that they need to have a couple of friends, for example, within the class area, and if they've got nice clean hands and after the loo, then that's always beneficial, and then that would be written in their needs, and that what the outcome would be. So for your child there, it would be Tommy is going to be able to wash his hands by the end of the summer term, for example, and that might be that you're only writing that in May. So a short-term sort of aspiration, and the provision would be how that's going to be met. So teaching assistant to go to the bathroom with Tommy to show and wash their hands, and then that would be shown as a complete outcome and a need met there. A longer-term aspiration would be that your child wants to be a YouTuber, which is often what we hear within information sessions, and so that would be built in there, that maybe some more IT work and things like that would be met, that they would have access to them and support within the classroom to be able to, if it's, for example, the child's got ADHD, but they can sit there for a longer period of time, or they can do it but they need someone to steer them back, that would go into the needs provision, the needs area. Outcome would be what's going to happen there, so that the child by the end of a year, for an example, would be sitting down in the classroom for an hour participating in IT work, and again that would be coming into your provision. So everything is linking up there. So does that make sense, Victoria?
Yeah. I think the other thing to cover around the different sections, particularly because we're talking about education, and the education sections of the plan are the ones that are sort of legally enforceable, which means that, say, section B has to have enough of a description of your child's special educational needs to have the right provision in section F. It's really important that if you are waiting for a draft plan, or even if your child's already got a plan and you haven't looked at it like this before, is to look at section F particularly, to see whether or not the provision is detailed enough. Something when we do these sessions with parent groups and things, a lot of parents will talk about some level of full-time one-to-one support. Quite often parents think that their child maybe has full-time one-to-one, but very often we'll see it worded in a much more sort of flexible way. So it might say something like, it would be beneficial for this child to have one-to-one where appropriate, or where possible, or if there is a member of staff who's available. Actually, if you're going to be needing, your child's going to be needing full-time one-to-one, you want it to be more phrased along the lines of dedicated full-time one-to-one throughout the school day. Do they need it during break times as well? So you're saying during structured and unstructured times, and whether or not that one-to-one, so it's a teaching assistant or a learning support assistant, should have any particular training, expertise. If your child has a more unusual diagnosis or something which hasn't been in the experience of school before, then does that one-to-one, so the TA or LSA, does that person need to have any kind of training? Sometimes we think about children who might have Rett syndrome, for example, more unusual than something like autism. Rett UK or Rett University, for example, would offer training. There's no reason why children who have autism wouldn't have a TA who's got training and experience in that. So it's really looking at every single provision in section F and seeing whether or not it has got sufficient detail, because if you know that you can see it's going to happen, then you can keep an eye on it. Also, the benefit for school and professionals working with your child is they've got something to work on, they know what they're supposed to be doing. So when you're either getting a draft plan, if you're new to the process now, or if your child's already got an education, health and care plan and you're just kind of watching for any further information, go back and have a look at the plan and look at each provision and see, will I know my child's getting that? Do school know what they're supposed to do? Because if it's correctly worded, then also they should get the right level of money from the local authority, so everything should work a lot more smoothly.
Okay, we have a question from Judith, and that is, can an education healthcare plan be useful for a school refuser, and if so, how? So
yeah, the short answer is yes, it could be useful. Often children, young people, school refuse. Well, sometimes, in my experience anyway, school refusing happens because their needs are not being met properly in school. School doesn't know what they're supposed to do, or perhaps isn't doing anything at all to support the child, and perhaps anxiety and those sorts of things build up, and it leads to not going into school. An education, health and care plan could be useful if you want your child, or your child wants to go back into school, whether it's the same school or a different school. You could be looking at an education, health and care plan which would give the correct level of support. So if it's one-to-one, if there needs to be some type of therapy, speech and language therapy, occupational therapy, or behaviour strategies, programs, those sorts of things, they can be written into section F. Then your child's school will have to make sure that they receive that support. Local authority will have to make sure the school has the money to deliver the support, and then it may be that by putting those in place, your child will be able to go back into full-time education. Some children will need to build back up, so school refusing is more of a significant problem, and it's not just sort of occasional. Then it might be that your child would need to have a transition back into school sort of plan, so it's not going to happen overnight. You get an education, health and care plan, and then all of a sudden they'll be fine, they'll go to school full-time. You could work with the local authority in school, whether it's the same school or you're looking at a new placement, to build that up. There could also be some tuition out of school that could be funded by the local authority. Some children want access e-learning, for example, if they're not able to leave the home, if things are at that stage. Other children may have a tutor who comes in. All of those things can be written into an education, health and care plan. The benefit of all of that is it's a legal document, and that is in force for your child, and your local authority will have to provide for it. Hopefully that answers your question in not too much of a sort of a roundabout way, but if there is a follow-on from that, Judith, if you've got any other questions, please let us know. I'm really happy to talk more about that if that's helpful.
Thank you, Victoria. Okay, so next slide is the local offer. So this is really just about making you aware of what's on, what's the provision is like for your child in your area. So this can be found on every local authority's website. For me to deliver the sessions I've delivered in the past few months in Cambridgeshire, they've been funded by the Cambridgeshire County Council Opportunity Area money. So I will talk about the Cambridgeshire County Council council website, but most of them are very, very similar. So the local offer will be found in the your local council website, and you can normally Google something from externally or get onto the web page and use the search, but it will come under the normally children and families area. And there will be lots of information about provision which is available for your children in your local authority, and that will go up into 25 in line with education healthcare plans. But there's all manner of different information on there around your child and provision, and with and without education healthcare plans. Contact always have an entry on local offers, so there's lots of links to other types of support, so do take a look at your local offer and be familiar with it. Some people also look at neighbouring authorities' local offer to see what they might have that's different, and sometimes we're looking at, actually we've got that in Cambridgeshire, that's really good. So it do take time to get familiar with that. It's basically there to make a provision more responsive to local needs, so you can actually put your own feedback into that, and that's published every year. So if you have any suggestions about how that could be changed or what else could be on a local offer, what you feel is missing, you can put that in on there, and as I say, it will be published every year. I think that's it really on local offer, and again we have a fact sheet on that on the contact website.
Okay, personal budgets, as I said, we weren't going to spend too long on it, so this is sort of a slide to sum up what is essentially quite a more complicated area than this, but it is something that we find when we deliver these sessions more widely, is that a lot of parents either don't know about personal budgets or are under the impression that they're perhaps something that they're not. So it is an identified amount of money from your local authority to deliver some or all of the provision set out in section F of your child's education, health and care plan. So some or all, so it may be that you think about a personal budget for one aspect of provision, or for some families it may be a personal budget to deliver all of the provision in section F. It can be requested by parents and also by young people themselves if that's appropriate, if they want to do that. It can include funding from education, health and social care. You can receive a personal budget in a number of ways. So the first is direct payments, which people are probably familiar with in terms of the social care area for direct payments. This is different. Anything that comes through an education, health and care plan is different to anything that comes directly from health or social care, although it may be referenced in the plan. Second way would be for the local authority to commission the support. The third way is that funds are paid to another organisation, so for example, a third-party agency type arrangement. And then the fourth is you could have a combination of the above. So some families will receive direct payments to commission some aspect of provision themselves, but may also receive a personal budget that they pay to an agency for some other area of provision. An example of where we see personal budgets used mostly would be if your child needs to receive some type of therapy or provision that's not available in school, such as physiotherapy, for example. Maybe your child's school doesn't have a physiotherapist that comes into school to work with children. So your child receiving physiotherapy in section F is all detailed. They're supposed to have an hour a week. It may be that school doesn't have somebody, so you could come into an agreement with the local authority that you receive some money for you to commission a physiotherapist. So you work with the school to agree a physiotherapist to come into school. You need to have school's permission for somebody to come in, and you pay them directly for that physiotherapy. The rest of the provision in section F can continue to be funded by your local authority directly to school. A lot of parents don't have a personal budget because they don't know about it, but also families don't necessarily want the responsibilities of it, so you don't have to have it. It's entirely optional. You can't be forced to have it. There are also rules around your local authority can refuse a personal budget, and there are exceptions and things to it. But if you want to know anything more about personal budgets, then there are fact sheets on contact. You're very welcome to contact either of us about it. It is not necessarily complicated, but it is something that's worth exploring if that's of interest to you.
Okay, thank you. We have Judith has kindly followed up with questions. So should the school be able to evidence how, when any 1-to-1 hours are specified in F are being provided? So should school be able to evidence that, and how is it being provided?
Yes, absolutely. Any provision which is detailed in section F, school should or have to be able to tell you how they are delivering that. So if we're talking about 1-to-1, if your child is going to receive anything other than full-time 1-to-1, you're going to receive, for example, 5 hours a week of 1-to-1, you would expect to be able to see a copy of a timetable that details where that 1-to-1 is being provided. So, for example, if the 1-to-1 is going to be in English lessons, you would expect to see a timetable where at every English lesson, underneath it says that your child will be receiving 1-to-1, probably on a school timetable, who that comes from, so Mr. or Mrs. or Ms. whatever. You don't necessarily want the name, and you can't really have the name of the person who's going to deliver the provision in section F, but you'd have the type of person. So if the 1-to-1 is going to be a teaching assistant or a higher level teaching assistant, then that's the detail that you'd have in section F. Part of the problem that families have in not knowing whether or not provision is being delivered properly in school is that there is not the correct wording for it in section F. So if you're, Judith, in your example around the 1-to-1, if that was to be in section F of your child's education, health and care plan, then you'd want to have it exactly detailed. So is it full-time, is it part-time? And then you can ask the school where they're doing that and how they're evidencing that. So a timetable is a sort of classic example of how you might find that out.
We have a slide which is on another presentation which has a bit of breaking down on that, so I can email that over to you, which just shows a little bit more wording on it. But that again goes back to the aspirations, needs, outcomes and provision slide. So there'll be an example of someone who wants to have friends, how he in his needs is communicating, and how he gets frustrated. And then there's outcomes about short-term and long-term, what would happen for that child, and the provision which would be in place, and that is broken down in that wording. So I can share that with the group after the present. What will happen is you'll get a link to this and to have a look at this at another time or re-watch it, and that will come going hopefully in the next couple of days. But in that, I believe the webinar administrator will have your emails, and I can circulate that slide after, which you might also find quite handy. So it just gives you a little bit of idea about wording. But we would always say within a session, if you've got an EHC or you're going through that process and you wanted someone to pick over that, how things are written out slightly, you can always let us know. Our helpline, you can discuss it with as well. And Victoria is really, really kind in giving her time to answer questions for parents as well. So please just always bear that in mind.
Yeah. So because we're on a slightly whistle-stop tour in our session today around Sen Support and education, health and care plans generally, what we often find people saying is that they've got an education, health and care plan, or once you've got an education, health and care plan, but they're perhaps not happy with the content. And quite often that's what, after you've been to a session or listened to some advice such as this afternoon, you might think, well, actually, I'm not happy with my child's education, health and care plan any longer, or when you receive the first one. So you can challenge an education, health and care plan. You will get a right of appeal against a final education, health and care plan, or a final amended if your child's already got one, or after an annual review. So the first thing to consider when you're looking at challenging something, if you've asked your local authority for something for your child in their education, health and care plan and they haven't agreed, then the first thing that you need to do is to consider mediation. So we've got on this slide here, there are two types of mediation certificate. Your local authority has to tell you that you have to consider mediation in their decision letter, and they'll provide you with details of mediation companies to contact. They are independent. They're funded by the local authority, but the way they keep it independent is to use mediation companies. So, for example, KIDS or Global Mediation, you probably see on the letter. You phone up the mediation company and you say to them, I've got a disagreement with my local authority over the content of my child's education, health and care plan, I want to challenge it. The mediators will then explain to you what it is mediation is. It's essentially a forum within which you can discuss with the local authority the issue or issues you disagree with and see if you can come to agreement. The mediator is there to act as a facilitator, so they're not a judge, they don't make decisions, but they do help to keep the discussion sort of moving and focused on the right things. If you decide, having heard what mediation is, that you don't want to try it, or you have already been negotiating with the local authority and they've told you their position is not going to change, you may decide that you don't want to go down the mediation route. You don't have to. So if you phone up, you find out what mediation is and you decide not to do it, the mediation company will provide you with a mediation information certificate. That basically means you know what it is and you decided not to go ahead. The other is, if you do go through mediation, once it's completed, you'll get a certificate to say that it's been completed. When you've got either of those certificates, you can move on to the next stage, which is an appeal to the Special Educational Needs and Disability Tribunal. It doesn't matter to the tribunal whether you've completed mediation or not. It's not something that they consider or are allowed to consider. So various different decisions that you can appeal to the Special Educational Needs and Disability Tribunal. Either as parents, you can appeal that, or your young person, once they become of age, can do that themselves. That will obviously be subject to potential issues around mental capacity. If your young person doesn't have mental capacity, then the appeal would become yours. It doesn't mean that they lose the right to appeal. So if there were any issues around that, then do take some advice. So the decisions that you can appeal, so right from the very beginning of the process, the decision not to carry out an education, health and care needs assessment, or a reassessment if you've asked for one of those because things have changed significantly. Decision not to issue an education, health and care plan following the assessment. You can appeal the description of your child's special educational needs, which are in section B, the special educational provision in section F, and the placement in section I. Not to amend an education, health and care plan following a review, so an annual review or a reassessment, or to cease to maintain the plan, which basically means to take the plan away because your child no longer requires it. As of April this year, there's also a pilot where the tribunal can consider and make recommendations, although they're non-binding, it's not the same as an order, can make recommendations in relation to health and social care. So if you've got some issues in the health and social care sections, you can ask the tribunal to look at that as well. If you were to do that, then those are going to be 2-day hearings, so it's just worth kind of bearing in mind. Any of these decisions can be appealed. So the Special Educational Needs and Disability Tribunal has a website. It's part of the court service. You can go onto the website and find the appeal form. If you have difficulty finding the form, the website can sometimes be a little confusing. Things can be in a different order. You can phone the tribunal and they will email you the right form as well and explain to you what you need to do. If you're considering going to the Special Educational Needs Disability Tribunal to appeal something, we would really strongly recommend that you take advice. It doesn't have to be from the solicitor, of course. You can contact anybody who's able to give you information and advice. So obviously the first step would be the contact helpline, just to talk through what the appeal process is, what you need to gather, because it is quite a tight time frame. From the day you lodge your appeal to the day of your hearing should be 12 weeks. So it's important to gather the right information and evidence and for you to prepare, so that you know what to expect and what you'll need to do, and whether or not you need to instruct anybody to help you with that, representation or independent experts and such. So whilst we've got one slide on this, there is much more information and advice that's available, so do make sure that you take advantage of that.
Okay, so last couple of slides now, our annual review This basically would happen once your child's plan is in place, and it should happen annually, as in the title, and it would be looking at sort of the child's outcome and reviewing the content of the plan, so making sure everything is as it is. Does things need updating, particularly if your child goes onto a plan quite young? Their outcomes will be quite different, and their aspirations will be very different at 4 as they will be as they grow older. So just making sure it's up to date and suitable, and it must be reviewed every 12 months, but should you wish to call an early review, particularly if there may be, for an example, that your child may be needing to move to a special education provision setting into a special needs school, then a review could be called earlier to get the ball rolling on that area. Or if there's something that's going on within school that you really feel needs changing, or things aren't happening, then you can ask for a review to be called earlier. And the review are normally held at your child's school or college. And again, going back to the earlier meetings, just make sure that you're prepared for it, taking in any documents that you might need, any questions that you'll have, and knowing that who's going to be there discussing your child. And within meetings, if you do want to take someone with you, do always ask the school first, or let them know that you'll be bringing someone in, so everybody knows. If you want to know who's in the room, rightfully they should be able to know as well. So do bear that in mind, and what their role is in that meeting. Are they going to be speaking or just taking notes for you? It's always handy to take notes, and particularly if there's going to be some outcomes afterwards or things that people will need to do. You can also like minute them and return them to the attendees in the meeting, so everybody knows what they're going to be doing from the parents and the school's aspect there.
After the annual review, just to briefly touch on this, your school, if your child's at school, the school will need to write a report on the outcome of the review, anything that was discussed, any recommended changes. They have to send that report back to your local authority within 2 weeks of the review meeting, and within 4 weeks of the review meeting, your local authority has to provide you with a decision letter saying whether or not they're going to make any changes to your child's education, health and care plan, whether they're going to just keep it as it is, or potentially even whether they are going to remove it. It's really important that if you've asked for changes and there is something important and your local authority hasn't replied to you within the 4 weeks, and it's something urgent, that you chase that up. A lot of families are finding that local authorities are not making decisions following annual review, and that might be because the school hasn't provided the report. So you can say to the school, well, when you email the report to the local authority, can you copy me in so that you can keep an eye on that? So if you had a review a few months ago and you're thinking, actually now listening to the webinar today, there are probably changes that I would like, I may even need to go to an appeal to the tribunal, then you can still, even if it's a couple of months later, you can still go to your local authority and say you haven't made a decision following the annual review, I haven't received that, can I have that? That will then trigger your right of appeal. It's just worth bearing that in mind as well.
Okay, so some useful links on here. I've talked about the Cambridgeshire local offer already, but if you go into any support services that are available will be shown on the local offer. Contact helpline, the details are coming up in a slide in a moment, but do go on and have a look at that local offer, and you'll find lots of contact numbers, emails, things like that where you can make contact with. Sen in Cambridgeshire, we're very fortunate to have a lovely service there who will work with parents. They are very busy, so the more notice that you can give them, the better. But again, they have a helpline that you can call into on a local basis there, and there's normally Sen provision across the country, and in Cambridgeshire, they're called Sendias. In some areas they're still called Parent Partnership, but there should be workers available there for you to talk to. Another organisation who are quite good on tribunal and appeal information are IPSI, so have a look at them to be familiar with what they do and see if they could help you at all. And finally, I've mentioned the Scn Fact Sheets. There's lots on there, as you can see on that slide, what are included, and it does talk about education healthcare needs assessment. There is a whole sheet on education healthcare plans on its own, and same with Sen Support. So they're sort of A4 size, so if you do want to print them, you can do. Our helpline can send you copies of them, or you can just download them to view online. And finally, the last slide is just about our helpline and contact number there. So there's just lots of little questions, and they're types of questions, and they are funded by the Department for Education to support you and advise you. So by all means, give them a call. They are very busy, but option 1 is for the SEN helpline, for the education helpline. And I've put my contact details on there, and Victoria's there for you. So this link will be sent out, as I mentioned earlier, so you'll see the details again. But I'd like to thank Victoria for her time today and all of her support in delivering the sessions. And but our details if you want to contact us. So, okay.
I might have another question.
Oh, no,
nothing.
We haven't had any more questions. I don't know if you have any more to add, but thank you for listening.
Great, thank you. Hope it's been helpful for everybody. And as we said, do ask us if you have any follow-on questions.